So what's the hope with computer vision? Is it on the clinician side to make their life easier?
So it's actually something that our chief physician and medical director are looking at right now is how can you scrub all the different social media sites for healthcare misinformation? Like a spoonful of bleach is not going to cure your child of whatever, but you can source all of that across those platforms, reference some of that potential misinformation against known good medical sources and documents and studies and all those types of things and actually provide a heat map that says this county is trending with this information that could have this type of an impact on healthcare. And then you can arm your ERs with it, your school nurses with it, your community health officials with it, and get ahead of, do you need to have some proactive messaging around something that could be a dangerous trend because people are taking that information as real and they don't have any way of kind of countering it with good factual information. And then you add the generative AI to it, and it can link it to the sites of here's where the true clinical information is, and here's a already generated public service announcement of how you can communicate that out to somebody in a third grade level without having to feel like really intimidating them from a high-tech solution. So that sourcing data, being able to get it in something that helps us be more proactive with health. And you think about that with what's happening with consumerization of healthcare, I just think there's a lot of potential in the way that we're going to look at broad data sources in the future that help care in ways that we're not even thinking about today.
Yeah, I love the social media use case and looking for misinformation. Some healthcare organizations have really gotten good at this social listening and being able to be responsive. And I remember hearing a story where somebody posted something on social media about their room or something at the hospital, and they were able to send somebody up to the room to address the problem. And I'm like, oh my gosh. At the time, I'm looking at that going, we wouldn't know about that until the person
Right.
had been discharged. And there's so much value in having that real-time information, keeping them from taking that spoonful of bleach and
Yep.
having access to real information.